Trauma is an experienced or witnessed event that is life-threatening or has the potential for serious harm or injury to yourself or others, and it really overwhelms your ability to cope. And when you experience trauma, your brain activates the fight, flight, freeze response. And this response shuts down thinking. It releases a surge of hormones throughout your body in preparation for like a physical reaction to keep yourself safe. Normally, after the threat has passed, your body will go into more restorative mode. But sometimes the trauma is so severe, or it's one of many traumas that have occurred over a period of time, that it interferes with your ability to feel safe. In PTSD, the brain and body get stuck in this fight, flight, freeze cycle, and you become trapped in this continual trauma response. The most common symptom is avoidance. So you avoid things that remind you of the trauma. The second most common experience is re-experiencing the trauma in some way. So you might have nightmares, you might have sensations in your body that feel like you're back in the trauma again, and you might have intrusive memories that also make you feel like you're back in the trauma again. And then you might think that you're to blame or there's something bad about you. You might think that the world is now unsafe, and you might also believe that other people are bad or can't be trusted. And lastly, your mood typically changes as well. So you might feel more irritable or angry or hypervigilant, and this really impacts relationships and becomes difficult to manage life. These types of symptoms will start the whole flight-fight response again, gets your whole body affected by trauma, and it oftentimes can contribute to chronic illnesses. Trauma can be experienced by anyone at any age with any background. There are many different types of trauma. There's acute trauma, which is like a car crash or something that maybe happens one time, like a natural disaster. Then there's chronic trauma, there's developmental trauma, and those are things where people have experienced trauma over a long period of time. Then there's intergenerational trauma, where many family members have experienced trauma and it passes down through generations. Or there's collective trauma, which maybe a school shooting, where we don't have to be directly experienced to be profoundly impacted by that trauma. And then there's racial trauma, ethnic discrimination, hate crimes, racism. All of these things can bring about PTSD symptoms, especially in those who don't have any supports to help process in a non-judgmental space. Medication and psychotherapy are the most beneficial when combined, and we do that here at Rogers Behavioral Health. We want to make sure that the patients know why they're doing what they're doing, and we teach them coping skills, right? So they're able to cope with all of the distress that is happening around them. It's important for them to turn towards the things that they have typically avoided for the last however long it's been since the trauma, in order to rewire that brain, right? So the brain thinks that these things are dangerous, and we're here to show them that they're not actually dangerous and they're free to live the life that they want to live.